Good evening, and hello to all the viewers who are right now live with me. I cannot tell you how happy I am to be interacting with you on a show. I am fine. Well, we saw a movie in which says I am fine. Well, we are on this show which says I am fine, and today we are going to talk on a subject which I'm sure is going to interest many people, and I am bombarded with questions on my private chat already. So let us start on looking at how to conceive easily. So conception is something which people are always wondering. First how long to wait, and how much to wait, and then what to do to conceive easily. Let me start with saying what is conception really. In the sense, what is important in conception is a woman's egg and a man's sperm. Both are very important. They are the seeds, and they have to meet in the fallopian tubes. Okay, and from here they have to move into the uterus, which is the soil. So let us talk of the seed and the soil, and what it takes to conceive and conceive easily. Okay, the first question I already have on my chat box is, when should we see a doctor? Well, I would ask Radhika, this question is from you, and I would ask, how old are you? How long you've been married? So if you have been married for 5 years and you have crossed the age of 35, then don't wait at all. If you are just married and you are young, say you are anything between 26, 27, 28, less than 30, then of course you can wait for a year, 1 year of staying together. And if you have not conceived, then you go and see a doctor. Okay, now talking of conception, what is so important is a woman is born with a finite number of eggs. Please understand, all of us women have been given a number of eggs which we are losing every month. So, what happens every month? Every month, a number of eggs start developing, of which one goes and becomes a dominant egg. The rest of all die. Now, slowly we are losing all our eggs, and by the time we are 40, we have lost most of our eggs. And as you know, menopause around age of 45, we've lost almost all our eggs. So please remember, if you are deciding to not marry early, then do something about your eggs, because we are losing our eggs. Do you know the best age for eggs is 21 to 24 years? Now, how many girls get married at that age? Not many. So if you cross the age of 24, and then you go ahead, become 30, 32, 35, and then decide to get married, then your eggs, or the quality and the quantity of your eggs, is already reduced or compromised. In that case, if you decide that no, I don't want to conceive, then please, right now, then please cryopreserve your eggs, or as you say, you can keep your eggs in a freezer and use them whenever you want to. Now, what is required to conceive easily, because that's the topic we are here to. Every girl should know what is a AMH. That's a blood test. Serum AMH is the anti-Mullerian hormone. It is a rough indicator of the number of eggs you have. If it is anywhere between 1 to 3.5, okay, you are all right. If it is less than 1, then that means you have no time to wait. So all the girls who are hearing, please go and get your serum AMH done, to be sure that you are, whether you have to hurry up or you have time to wait. Okay, so AMH is one test. Second test that is important if you want to conceive is your fallopian tubes. Are the fallopian tubes open? Because fallopian tube has got two ends, a fimbral end and a cornual end. Both ends should be open, because conception will happen in the tube. So the fimbral end will catch the egg, and the cornual end, the sperm will travel, and they will meet in the fallopian tube. So get your hysterosalpingogram, that is the HSG test done, to be sure that your tubes are open. I have seen couples, who will come after 10 years, and they say, we've been trying and nobody has got an HSG done. We have no idea on the patency of their tubes, and their tubes are blocked. Tuberculosis is so common in our country. People don't know. Half the time tuberculosis is diagnosed only when an infertile couple walks into your OPD, and you realize the tuberculosis has already blocked their tubes, destroyed their endometrium. So it is important to get an HSG done to know your tubes are open. Thirdly, you should have a broad look at the uterus with an ultrasound to know that you have a good uterus. Well, if you don't know, there are a lot of girls who are born without uterus or a very small or atrophic uterus. So you should know that you have a good uterus, and there are no fibroids, there are no endometriosis, no adenomyosis, so many diseases which can happen in the uterus to destroy the lining, and therefore conception doesn't happen well. So this is as far broadly the test concerned as far as the woman is concerned. Now I already have another question. When is the right time? When the right time to conceive? Always remember that 1 week before the menses, during menses, and 1 week after the menses, you are safe. That means you don't conceive if you have sex at that time. So, your sex life, you should have frequent sex. That means at least on alternate day, starting 1 week after the menses. So, the mid 2 weeks, from day 10 to day 20 of your cycle, is the time when you should be having sex every second day at least, if not every day, to increase your chances of conception. Thirdly, what is so important is your lifestyle. Are you having a good lifestyle? Are you having a right weight? If you are overweight or underweight, it's important to have a right weight. Secondly, it is important to exercise. The hormones of exercise really increase your chances to conceive. So half an hour of aerobic exercise, whether it is walking or swimming or dancing or whatever you want to do, it is so important. Have a diet which is full of green leafy vegetables and fruits, because they are the antioxidant and scavengers of your body. And please do not use alcohol and smoking. These are two things which are detrimental to both eggs and sperms. So, specifically in men, I would say please stop smoking if you are trying to conceive, because the damage to sperms because of smoking is very, very high. So, if so those men, please take care. No alcohol, no smoking, at least when you are in the 2 to 3 months when you are trying to conceive, because every cycle will take about 3 months to have an effect. It's not that today you don't smoke and tomorrow you give a sample and you expect, okay, we'll have a good sample. No, because it takes 3 months for the store to change. So you will have to give yourself good 3 to 6 months. So if you are less than 35 and you have a good reserve, your AMH is good, it is okay. You can wait for say a year. But if you are more than 35, please don't wait. 6 months will be more than enough for you to be together. If you're not conceived, go and consult a fertility specialist. It's very, very important. Always go as a couple. I've seen so many girls walking in. So many tests are to be done for a woman, and only one test for a man, and that is his semen analysis. So, and it is so easy to give an ejaculate. A man just have to be not having any intercourse or masturbation for minimum 2 days and not more than 7 days. The gap should not be so much, because you get old sperm, and it should not be very short. So the gap should be around 2 to 7 days, and then go and give a sample. It should reach the lab within an hour, and then it is tested for three things. One is count number. It should be more than 15 million. 15 million. Motility. The sperm should be motile. At least 40% of the sperm should be motile. And third is morphology. At least 4% should be good looking sperms with a normal intact acrosome and nucleus. So if you have these three parameters, a man's role is nearly finished. He doesn't have to then bother so much. Then it is a woman. So woman is, I've already said, AMH, HSG, and an ultrasound for her. Besides, you also have to rule out any thyroid, any sugar, any prolactin. Her hormonal profiles have to be normal, and her thyroid should not be. Remember, your TSH should be less than 2.5 if you are trying to conceive. So don't go by saying, they come to me and they say, doctor, my report is normal. It's less than 5. But for conception, we want your TSH less than 2.5. So it is important, and take your folic acid at least 3 months before. Start taking your folic acid, and no alcohol, no smoking. That goes for you also. I've already told how can you check ovulation. Now there are girls who have PCOS who don't know when they are, they don't know the cycle length. Some lengths are, what is the normal cycle length? Well, from anything between 28 to 35 days is okay. But if it is, say 45 days, 60 days cycle, there are girls who don't cycle, every month. They take 2 months to cycle. Then it is going to be little difficult to find out what is the right cycle date, right date for ovulation. What you can do. So how do you test ovulation? Now that is an important day for you. I always tell all the couples, please don't fight, pamper each other, be in the right mood, otherwise you miss out on those right 2 3 days. Remember, it is only few days in the month when you are fertile. If you miss out on those days, even if you are together all the rest of the month, it's not going to matter. And remember that the sperm and the egg have a life, 24 to 48 hours is the time, when the sperm and the egg are alive. If they are able to meet at that time, you conceive. If no, then you don't. Well, there are ovulation kits. You get urinary LH kits. All you have to do is take the kit, put 3 drops of urine, and see the day you get 2 lines on an LH kit. I'm not talking of pregnancy kit. I'm talking of an LH or an ovulation kit, in which, so you start, from day 10 onwards, you start doing this test every day. Okay, today only 1 line, next day only 1 line, third day 2 lines. The moment you are getting 2 lines, that means you are going to ovulate after 24 hours. So next day you should be in contact. You don't miss out that day, because that's the day you're going to ovulate. So the LH surge comes about 24 hours before. So in the next 24 hours, you definitely take time to have intercourse together. Now, as I talked of male and female, now I can see so many questions on my chat box. So let's go on the right. I am 41 years old, and what are my chances of conception? So at 41, as I just said, that chances of conception are lesser. See, between 20 to 30, you have, even if you are very close to ovulation, you have about 60% chance to conceive. From 30 to 35, you have about 40% chance. From 35 to 40, you have about 30% chance. And after 40, your chances of conception are around 10%. So the chances of conception are reducing as a woman is aging. It is not so in case of a man, unfortunately, but that is the truth. Okay, the next question on my chat is, my husband is unable to ejaculate inside me. What to do? Well, uh, if he's able to ejaculate outside, even if he's not able to ejaculate inside, he can give the sample in the lab. We can wash it. We can, put it, do an intrauterine insemination or IUI. Now, what is an IUI? It's a procedure in which the man's sperm is washed and put with a catheter, put right inside the uterus, close to the tube, so that the sperms are able to flow easily and fertilize the egg got there. So at the right time, we are doing a follicular monitoring. We see the egg coming out. We put the sperm, and the chances of success of IUI is around 1, 5, 15% worldwide. Remember, it is not as if it's 100% procedure, but yes, every month, we have a lot of nurses whose husbands are away. They are going for a year, 2 years. So they come and store sperms with us. We can freeze their sperm, and every month, during the right ovulation period, they come to us. We thaw the sample and we put them, and they have an equal chance of conception as if they were together. So this is one way of people who are not able to ejaculate inside but are able to do it outside. Next question is, my semen shows a zero motility and less than 1 million count. Can I become a genetic father? Yes, as long as your semen, or as long as sperms are there in the ejaculate. Definitely, because they have zero motility. So, and the count is very low. I told you 15 million is the count you are looking at. If it is very low, if it is less than a million, then you will require an IVF or in vitro fertilization procedure. As they say, that means the eggs are removed from the body outside in a test tube. The husband sample is taken. They are made to fertilize outside, grow out, for a few days into an incubator. When the embryos are ready, you can see that they are growing. Your babies are outside. Then they are put inside the uterus. Let me clarify here itself that it's IVF is a painless procedure. A lot of people think IVF is a painful procedure. I would like to remove that myth. There is no pain whatsoever. Yes, injections are there for about 10 days, starting from second day of the cycle, and injection. But the injections are with a very very fine needle, and I in fact patients take it themselves, so you can see how easy it is. The pickup, when the eggs are ready, when they are ripe, we take them inside the OT, and under an anesthesia procedure, needle is put through the vagina into the fornices, and the eggs are removed in a petri dish, and the husband's sperm is taken, and an ICSI procedure or a conventional IVF can be done. That means what you are doing is what is not happening in the body inside. You're not sure. You are doing it in front of your eyes outside, creating those babies, making the babies ready, and then through a catheter, putting them right inside the uterus of the woman. So, this person with zero motility, I can always pick up with a needle, and less count is very, very low. You can become a genetic father yourself because but you will have to undergo this procedure of IVF or in vitro fertilization or test tube baby as it is called. Okay, now another question is from a woman who says, this is Mrs. Sharma. She writes, I am menopausal and now aged 45 years. I want to become a mother. Can I? And how? So she may have missed the bus, but she can still catch the bus, as they say. She is menopausal, so her period have stopped, and that means her egg are are not there anymore. So she will require the help of an egg donor. So what we'll do is we will take the eggs from an egg donor or an egg bank, and we will fertilize it with her husband's sperm, make the baby ready, prepare her uterus, because it's a menopausal uterus, we'll have to do some kind of preparation and then put inside her, and then she can have the privilege, the pleasure of being a mother even at the age of 45. So don't lose hope. Whatever age you are in right now, you can still become a mother. So, Mrs. Sharma, you're welcome to take help. Okay, now another question I already have is, I have zero sperm count in my ejaculate, and I have tested multiple times, but I do not want a donor sperm. I am very depressed. Please help. So, this is a condition which is called azoospermia or zero sperm count. That means there is nothing in the ejaculate. What we'll have to check is whether the testes are having sperm. Testes are the factory from where the sperms are produced. So, if we put in a needle in the testes or in the epididymis, it's very, very simple procedure, absolutely painless again. A small needle, and we can draw out the sperm from the factory. So, what has happened is that there is some kind of obstruction in the tract, and the sperms are not coming out in the tract. So, the ejaculate does not have the sperms, but the testes or the factories, they have enough sperms. All we have to do is put in a needle, take out the sperms, and then take out the woman's eggs, again do an IVF ICSI. So this is called a PESA or a TESA. So either per epididymal sperm aspiration or a testicular sperm aspiration, we can take out the sperm and you can still become a genetic parent. I've done this for so many people, and I feel so satisfied, because I know donor options are not the options which anybody is looking for. So if possible, and if you can become a genetic parent yourself, why not? Well, we are quite a lot midway. I would encourage all of you to please keep putting your questions because I'm here रूबरू with you, आपके सामने हूँ. कुछ भी आपको पूछना हो इस प्रोसीजर को लेकर, आईवीएफ को लेकर, इनफर्टिलिटी को, कंसेप्शन को लेकर, आपके दिमाग में कोई ऐसी दुविधा हो कंसेप्शन को लेकर और आप जूझ रहे हो इस स्थिति से, और आई एम श्योर मैं इतने लोगों से मिलती हूँ, इतने डिप्रेस होते हैं लोग, और मैं कई बार सोचती हूँ कि साइंस ने आज इतनी तरक्की कर ली है कि हर कोई, आई मीन इट, हर कोई माँ बाप बन सकता है अगर वो आज चाहे तो. देखिए, थोड़ा धैर्य, पेशेंस, परसिवरेंस, जुझारू तो रहना पड़ेगा, लगे रहना पड़ेगा, धैर्य भी रखना पड़ेगा, और कुछ खर्चा भी जरूर होगा क्योंकि नथिंग कम्स फ्री. अगर आपके पास पेशेंस, परसिवरेंस और फाइनेंस हो तो मैं नहीं मानती कि आज कोई भी इस पेरेंटिंग या प्रेगनेंसी से वो महरूम रह सकेगा. सो I can see, is IVF bed rest is compulsory? If yes, then how many months? My age is 38. Beautiful, Kiran. I am so happy you asked me this because वो ज़माने बदल गए जब आपको आराम करना पड़ेगा. अब आपको आराम करने की जरूरत नहीं है. I will tell you, you won't believe it. USA से, UAE से, every patient just fly in, land, take the embryos and fly back and go back to work. I trained in Belgium and let me tell you, काम से लोग लंच आवर में आते थे, अपना काम एम्ब्रियो डलवाया, वापस काम पर. Gone are those days when bed rest was compulsory, not at all. वो एक जमाना था जब लोगों की मदर इन लॉज उनको पॉट भी बेड में दे रही है. नहीं, अब जरूरत नहीं है. So now bed rest is not at all. देखो, अगर टिकना होगा तो एम्ब्रियो ऐसे भी टिकेगा क्योंकि विद इन सेकेंड एम्ब्रियो क्लच करता है आपकी यूट्रस लाइनिंग को. सो थैंक यू फॉर आस्किंग किरण शाह. यू डोंट रिक्वायर रेस्ट एट ऑल एंड आई मीन नॉर्मल. मैं ये नहीं कह रही हूँ कि नाचना कूदना है उसके बाद जाके, बट आप अपना रूटीन काम करिए, उससे कुछ भी नहीं होगा. सो HMG और FSH और कैसे देते हैं? वेरी नाइस. सो दोनों हॉर्मोन्स हैं, FSH भी और HMG भी. और मैं आपको ये बता दूं कि ये बहुत बारीक नीडल से पेट के ऊपर, आपने अपना पेट पकड़ा, आपने देखा होगा इंसुलिन जैसे डायबिटिक्स लगाते हैं अपना खाने से पहले, ये वही बिल्कुल. अगर हर आदमी खाने से पहले अपना एक इंजेक्शन लगा सकता है तो 10 दिन का इंजेक्शन तो आई एम श्योर एनीबडी कैन टेक. इतने खूबसूरत तरीके आ गए हैं, पेन्स आ गए हैं जिसमें आपको कुछ भी मेहनत नहीं करनी, बिल्कुल पेन नहीं है. एकदम बारीक पेन से आप अपना इंजेक्शन पेट पे लगा सकते हैं, खुद लगा सकते हैं. आपको रोज हॉस्पिटल आने की जरूरत नहीं है, हम आपको सिखा देंगे. आप घर जाइए. जरूरी है फ्रिज में रखना, चाहे FSH हो, चाहे HMG हो, चाहे कोई भी हार्मोन हो. फ्रिज, कोल्ड चेन इज वेरी इंपॉर्टेंट. अगर ऐसी जगह पे है जहां पे फ्रिज नहीं है तो ये मुश्किल होगा क्योंकि कोल्ड चेन बहुत जरूरी है. ओव्यूलेशन इंडक्शन, रुखसार पूछ रही हैं हमसे कि ओव्यूलेशन इंडक्शन के बिना IUI हो सकता है? IUI में देखिए, एक सिंगल एग चाहिए इनसाइड द यूट्रस. यू रिक्वायर जस्ट वन सिंगल एग क्योंकि उसमें हमें बाहर नहीं निकालने हैं. बॉडी के अंदर तो एक एग और स्पर्म अंदर चला जाए और प्रेगनेंसी हो जाती है. तो ओव्यूलेशन इंडक्शन के बिना IUI हो सकता है. हम खाली ये कहते हैं कि जब आप डॉक्टर के अंडर हैं तो डॉक्टर को अगर लग रहा होता है कि एक थोड़ा छोटा है, एक सोचिए एक आम का पेड़ है और आप कच्चा सा आम उतार लें, इससे आम को पकाने के लिए अगर कुछ देना पड़ेगा तो देना पड़ेगा, बट इट इज वेरी मच पॉसिबल. IUI हमने कई बार बिना कोई दवाई या बिना इंडक्शन के भी करा है. अगर एग आपका रेडी है, एंडोमेट्रियम भी रेडी है, तो आपको क्या करना है, राइट टाइम पर उसको रप्चर करवाना है और रप्चर करके आपको राइट टाइम पे वॉश स्पर्म डालना है. वॉश स्पर्म डालते ही IUI में हो जाएगा. रिमेंबर. अच्छा, अब रुखसार और पूछ रही है FSH और HMG किस टाइम देते हैं अगर फॉलिकल ग्रो नहीं कर रहा तो? अगर फॉलिकल ग्रो नहीं कर रहा, देखिए फॉलिकल अरेस्ट हो गया है या किस टाइम पर है, ये देखना थोड़ा ज़रूरी है कि जब जैसे जैसे हम हार्मोन बढ़ाते जाते हैं, एग भी आपका द साइज ऑफ द एग कीप्स इंक्रीजिंग. if it is not increasing, it's got arrested. There are so many ways to do. ऐसे ही एक क्वेश्चन मेरे पास है कि मेरे यूट्रस में मल्टीपल फाइब्रॉइड्स हैं, एंड डॉक्टर ने जवाब दे दिया है कि मैं माँ नहीं बन सकती क्योंकि जहाँ पे बच्चे को बैठना है वहां पर फाइब्रॉइड्स बैठे हैं। तो आप मैं मानती हूँ कि अगर मल्टीपल फाइब्रॉइड्स हैं और वो सबम्यूकोजल हैं और इंट्राम्यूरल हैं और इतने बड़े हैं, एक तो तरीका ये कि हम फाइब्रॉइड्स निकाल दें, कैविटी को रिकंस्ट्रक्ट करें और उसके अंदर बच्चा डालें। दूसरा तरीका ये है कि सरोगेसी आपके पास, अगर अगर आपकी अपनी कैविटी होल्ड नहीं कर सकती है, बच्चा आपका जेनेटिकली, आपका, आपके ओवरीज, आपका एग है, आपके हस्बैंड का स्पर्म है, दोनों को बाहर मिला के बेबी रेडी है, अगर आपका यूट्रस होल्ड नहीं कर पा रहा तो सरोगेट में हम जरूर डाल सकते हैं। साक्षी पूछ रही है मुझसे, माय हस्बैंड एंड माय रिपोर्ट्स आर नॉर्मल, देन व्हाई एम सो इम्पोर्टेंट। साक्षी, you won't believe 50% of the people have this problem. All reports are okay. Mota mati, when we are seeing your, woman is all right, man is all right, yet they are not able to conceive. Why? One, as I told you about, the timing is important. Your sex life has to be good. You have to meet at the right time to conceive. So please be sure, go to the doctor, find out the right time, and then be together. That's one. But agar nahi ho raha, what we call unexplained infertility, and 50% of the people have unexplained infertility for which they require this process of IVF, IUI or IVF. तो इट इज इम्पॉर्टेंट, आप टाइम मत खराब करिए, आपके एग्स खत्म ना हो जाए. इट इज वेरी इंपॉर्टेंट. योर एग्स हैव अ लाइफ. आई एम रिपीटिंग दिस अगेन एंड अगेन because I get celebrities and film stars, and when they come and say around 38, 39, and they say, I wish we had known. I mean, they knew they're not going to get married early. Then why did we know? We could have cryopreserved our eggs. Why we didn't do that? Because you're not aware that eggs have a life. They think they're very healthy, they're exercising. So, but eggs still have a life. So please remember, marry right time or cryopreserve your eggs. Do one thing. Okay, is it difficult for, this is Usha Call asking, is it difficult for PCOS patient to conceive? And see, PCOS, to tell you, instead of one, you have many eggs start developing in the ovary. Not one good egg, but you have many eggs. Okay, now, is it difficult? Well, slight problems may be there. I'm not saying that you may require a little bit of help, but that is not big. And in a PCOS with the weight gain and hair growth and so many other issues, it is important that you consult a doctor if required. So don't worry if your daughter or your somebody has PCOS कि इसमें कोई प्रॉब्लम आएगी ऐसा नहीं है. बट हाँ, हार्मोन प्रोफाइल इज अ लिटिल आउरी, testosterone levels are high, insulin resistance is high. So it is important कि हम ऐसे वाले बच्चों को एक्सरसाइज एंड जंक फूड से दूर रखें और एक्सरसाइज करवाएं, क्योंकि वेट जो है इनको जरूर अपना लेवल पे रखना पड़ेगा, क्योंकि अगर वेट को जगह पे नहीं रखा तो फिर चांस है कि प्रॉब्लम हो. So this is what I have seen till now. Please go ahead and type your questions, because I'm here to answer all your questions. Anything that you would like to ask. सरोगेसी के बारे में मैं तब तक आपको बता देती हूँ कि सरोगेसी इज अ प्रोसीजर जिसका बिल अभी पार्लियामेंट में है, अभी आया नहीं है, बट इट मे कम एनी डे. एंड टिल दैट टाइम वी नो कि सरोगेसी में जो बर्थ सर्टिफिकेट है वो आप ही के नाम का होता है. एंड देन पेरेंट्स आप हैं, जेनेटिक पेरेंट, इंटेंशनल या कमिश्निंग पेरेंट्स जो होते हैं उनके नाम पर बर्थ सर्टिफिकेट बनता है. तो सरोगेसी इज अनदर वेरी ब्यूटीफुल ऑप्शन फॉर पीपल हु हैव प्रॉब्लम्स विद द यूट्रस और मेनी फेल्ड आईवीएफ साइकिल्स. अब आपने 4, 5, 6 साइकिल्स कर ली हैं और आपको समझ ही नहीं आ रहा क्यों काम नहीं कर रही, आपकी बॉडी क्यों रिजेक्ट कर रही है एम्ब्रियोज को. तो ऐसे लोगों के लिए भी सरोगेसी एक तरीका है. AMH, Kiran Shah लिख रही है कि AMH report is 0.79. How many chances? Well, Kiran, I think if I remember, you said 38 with the AMH, which is 0.79. You have to hurry up. You really have to hurry up, because मेरे हिसाब से तो 1 महीना भी वेस्ट नहीं करना चाहिए, क्योंकि आपका AMH is falling now, and whatever number of eggs that you can retrieve और जो आप IVF करवाइए, because इस रिपोर्ट के ऊपर I don't think you have much time to waste. Next is Sayyed is asking, my wife is 40 and a patient of thyroid, and moreover, she is recently diagnosed with diabetes. Is there any chance of getting pregnant through IVF, and does she have to take insulin on the process? दूसरा question, ma'am, ectopic pregnancy occurs in IVF treatment, please advise. Okay, so both the things I will tell you, thyroid और डायबिटीज दोनों ही करेक्शन करनी बहुत जरूरी है. 40 इयर्स की हैं, दोनों चीजें करेक्ट कर कर ही आप आगे बढ़िए, क्योंकि दोनों चीजों से एनोमलीज के चांसेस ज्यादा होंगे. देखिए, हमें बच्चा नहीं करना, हमें अच्छा बच्चा करना है. वी डोंट वांट अ बेबी विद एनोमलीज और डाउन सिंड्रोम और एनी अदर सिंड्रोम. तो बड़ा जरूरी है कि हम अपने जो थायराइड और डायबिटीज और जो और हमारे मेडिकल इश्यूज हैं उनको कंट्रोल करें. एंड यस, शी मे हैव टू टेक इंसुलिन, बट दैट इज ओके. अगर उससे आपको अच्छा बच्चा मिलता है तो मुझे लगता नहीं है. एक्टोपिक प्रेगनेंसी आईवीएफ में हो सकती है, आई एम नॉट सेइंग इट कैन नॉट हैपन, क्योंकि कई बार अगर ट्यूब्स खुले हैं तो एम्ब्रियो घूमते घामते उसमें भी जा सकता है. बट नाउ डेज मेडिकल मैनेजमेंट फॉर एक्टोपिक इज देयर विच विल ऑल्सो टेक केयर ऑफ दैट. सो नॉट टू वरी. मेरे ख्याल में आदमी कॉम्प्लिकेशन में इतना खो जाए कि उसको रियल चीज का वो ना करे, तो आई डोंट थिंक दिस शुड बी अ डेटरेंट सैयद फॉर टेकिंग द प्रोसेस. So Ashnika is asking, how do we know which fertility tree where is suited for you? Now, this only the doctor can tell you. And if your tubes are open, if you are a young patient, your AMH is good, you haven't been trying for 1 year, 2 years, 3 years, then go ahead, get an IUI done. देखिए, मैं ये चाहती हूँ कि लोग बैठो मत. आपको जरूरी है कि go ahead, take the help of the right person. एंड आई वुड से फर्टिलिटी स्पेशलिस्ट. देखिए, मैं कई जीपीज भी बैठे हैं और कई लोग हैं जिनके पास लोग चले जाते हैं और लटके रहते हैं. क्या होता है, कई साल तक वो उनके, अरे डॉक्टर हम इलाज तो करवा रहे थे, हमें 5 साल हम इसी डॉक्टर के संग थे. प्लीज सी, दे आर नॉट फर्टिलिटी स्पेशलिस्ट. हाँ, कुछ डॉक्टर हैं जिन्होंने अपना सब कुछ छोड़कर खाली इसी के ऊपर कॉन्सेंट्रेशन किया है. तो इट इज इंपॉर्टेंट दैट यू रीच टू द राइट डॉक्टर हु नोज व्हाट टू गिव यू द बास्केट. आईयूआई भी है, आईवीएफ भी है, सरोगेसी भी है, सो मेनी थिंग्स आर देयर. तो उस डॉक्टर को ये सब पता होना चाहिए. तो प्लीज गो एंड कंसल्ट द राइट डॉक्टर, and whatever will be right, I think the doctor will give you that. Can PCOS affect my chances to get pregnant? Anisha, PCOS थोड़ा बहुत प्रॉब्लम आ सकती है, मैं ये नहीं कहूंगी. एज आई टोल्ड ऑलरेडी कि इसमें लॉट ऑफ एग स्टार्ट डेवलपिंग, बट यू रिक्वायर वन गुड एग inside the body. So we have to just give you, we have to give you some ovulation induction. हम ऐसी दवाइयां दे सकते हैं जिससे कि आपके 1 या 2 एग्स आगे बढ़े, and that can have Anisha is also saying, what about the length of my cycle? Yes. So as I told you, Anisha, it is important कि आपकी जो लेंथ ऑफ द साइकिल है, इम्पोर्टेंट इसलिए है कि अगर आपकी साइकिल 3 महीने में एक बार आती है, अब 3 महीने में आपको तो पता नहीं चलेगा ना फर्टिलिटी का टाइम कब था. अब या तो इंसान रोज रोज इंटरकोर्स कर रहा हो, अगर नहीं कर रहा तो उसको क्या मालूम वही दिन मिस हो जाए जब वो फर्टाइल होता है. तो ऐसे लोगों के लिए लेंथ ऑफ साइकिल इंपॉर्टेंट है. देखिए, अगर आपकी 28 डे साइकिल है, आज से हर महीने की 7 तारीख को आ रही है, तो आपको आइडिया है कि इतनी मेरी साइकिल है. अगले मैं जो साइकिल आए, हाँ प्लीज दिस नोट दिस, अगर आपको पता है आपकी साइकिल कब आनी है, वो डेट आप अंडरलाइन कर लीजिए कैलेंडर पे, और उससे 14 दिन माइनस कर लीजिए. सपोज आपकी साइकिल आनी है 28 सितंबर को, तो आप 28 को गोला मार लीजिए और -14 यानी कि 14 सितंबर आपका राइट डे है कंसेप्शन का. तो आप 14 को मिस नहीं करेंगे. उसके आगे पीछे, क्योंकि साइकिल खाली 28 सितंबर को, कभी 26-27 भी हो सकती है, 29-30 भी हो सकती है, तो उसके आगे पीछे के 2-4 दिन जो है वो आपके लिए बड़े इंपॉर्टेंट है. दिस इज द वे यू शुड really. There are a lot of apps which are there, you can use the app. There are the ovulation kits that we talked of, but this is for people with a regular cycle. It is easy to conceive if you can just know exactly. So there are people, कईयों को ovulation के टाइम पर थोड़ा दर्द होता है, थोड़ी स्पॉटिंग हो जाती है. तो यहाँ पीपल जिनको बिल्कुल एग्जैक्ट टाइम करके बोल सकते हैं कि हमारा ओव्यूलेशन हुआ है, वेल दे आर दो लकी वंस. मेन को मैं एक चीज और बोलूंगी, याद रखिए कि भगवान ने जो टेस्टीज हैं उनको बाहर क्यों हैंग आउट किया है, ताकि वो कोल्ड रहे, कूल रहे. इनसाइड द बॉडी देयर लॉट ऑफ हीट एंड स्पर्म्स कैन नॉट सर्वाइव इन टू मच ऑफ हीट. तो अगर आपका लैपटॉप लेके आप काम करते हैं, जो लैब पे रखते हैं, या आप टाइट बॉक्सर्स पहनते हैं, या बाइसिकलिंग करते हैं, एनीथिंग विच इज कॉजिंग, या आप ऐसी जगह स्मेल्टिंग फर्नेसेस वगैरह में काम करते हैं जहाँ बहुत हीट है, heat is detrimental to sperms. So आप चाहिए तो lose wear loose underwear, work in a, be careful, be conscious that you should not be in too much of a heating condition whenever you are trying to conceive. तो टेम्परेचर की जो बात है, ये मैं लैपटॉप और मोबाइल का ज़माना है, हर कोई दिन रात लैपटॉप को लेकर ही बैठता है, छोटे से छोटा बच्चा ले लीजिए, बड़ा ले लीजिए. सो इट इज इम्पॉर्टेंट दैट यू कीप दिस इन माइंड. एंड anything else, please keep shooting your questions because I'm still with you. And आपका कोई भी क्वेश्चन हो जो आप पूछना चाहें, हमसे ज़रूर पूछिए. Anything else that is, so we talked of, again I will just reiterate and say कि आप कंसेप्शन की तरफ टेंशन मत लीजिए, और लगे रहिए, ये मैं ज़रूर कहूँगी, क्योंकि मेरे पास ना अपने कॉर्पोरेट वर्ल्ड से भी बहुत बच्चे आते हैं. एंड दो चीज़ें होती हैं, एक तो हम अभी तैयार नहीं है, अभी हमें बहुत कमाना है. हर बच्चा जो 30, 31, 32 साल का होगा, उसकी अभी सीढ़ी शुरू हुई है, वो सीढ़ी चढ़ रहा है. ऐसा मुझे आज तक कोई नहीं मिला जिसने ये कहा हो कि आई एम सेटल्ड. सो आई ऑलवेज टेल देम कि फर्टिलिटी क्लॉक नहीं रुकने वाली. So I know money is very important. I know careers are very important. But remember, your fertility clock is not going to wait. And it is okay, even if you are earning not that much, you are climbing your stair. But still, remember कि उम्र यही है बच्चे होने की भी, आगे बढ़ने की भी. तो आप इसको लेकर ये नहीं करिए कि अभी हम रुक जाते हैं. दूसरी चीज़ है, कॉर्पोरेट वर्ल्ड में लोगों के पास वक्त नहीं है. कितनी बार हमको आना पड़ेगा क्योंकि हम काम कर रहे हैं और हमें छुट्टी नहीं है. थोड़ा सा तो वक्त निकालना पड़ेगा. देखिए, इफ वी आर ट्राइंग टू कंसीव एंड यू आर गोइंग टू ब्रिंग अ होल न्यू बॉडी इनटू योर वर्ल्ड, उसके लिए भी तो आपको वक्त निकालना पड़ेगा. क्योंकि इफ यू थिंक यू रिक्वायर बच्चास and you want to be happy playing with your kids, it is important to take out time from their busy schedules and take out time for this. So I think it is my pleasure. I am so happy to have been with all of you today. I am Dr. Rita Bakshi, Chairperson, Riza IVF International Fertility Center, Delhi. My center is in Green Park. And if you have any questions which I can answer, it will be a pleasure. And for anybody who requires any kind of help as far as fertility is concerned, I'll be more than happy to help you, and also to say I am fine, I'm fine, I'm fine. So as far as your conception is concerned, go ahead, take out time, and I'll be more than happy to assist you. Thank you so much. This is Dr. Rita Bakshi signing off. Thank you.